So now I'm going to dig into the findings of our study. And before I begin, I would like to thank Maria Gonzalo, who is really the person behind this whole project. Maria worked very closely with the Research and Training Institute of the Cancer Support Community and was guided by our advisors to develop the survey, to field the survey, to dig through the data, to write the report, and to put together this presentation and this whole day today. So Maria, thank you very much. When you leave here today, you will be handed a copy of the report that basically summarizes the findings from this study. A lot of the images that you'll see today will be in that report, so you don't have to take any screenshots or worry if you're missing some of the figures, because you will have that at your fingertips when you leave, and it will also be posted online. I believe it was posted at 9 a.m., so you can always download that from cancersupportcommunity.org. So I have a few slides that just set the stage for us, but I think everyone in this room is aware there is an increasing number of cancer survivors. The costs of care continue to rise. And the good news is that there are fewer uninsured individuals in the US today because of the Affordable Care Act. So that's fantastic. Digging into what we found about our survey on access to care in cancer. So some of you are aware that in 2014, we did a study that was looking at the patient impact of the first year full implementation of the Affordable Care Act. And we, as many of you, were very mindful that the devil was really in the details for how the Affordable Care Act was actually implemented. And so the purpose of this study that we're speaking about today was to really identify patients' issues, challenges, and barriers and concerns accessing healthcare insurance, what their access to services was like, what they experienced around treatment decisions. Did they feel supported? Were they left out with no support? What their costs of care were, did that change at all? And what cost containment strategies were implemented? So essentially, the findings of this study were associated with two major buckets. The first was around issues around cost, and the second was around understanding. Specifically, patients are experiencing increased costs. They're experiencing a significant level of uncertainty about a number of issues. And they're also experiencing delays in access care, which we've heard can be very distressing. They're also making trade-off decisions. So Vijay's story about her friend Beth kind of speaks to that perfectly. People are delaying or not receiving treatment. And these are things that none of us would want anyone to face, even if we don't know them. That this is not something that people who are going through a cancer experience need to be facing. So we'll dig into the specifics of this a bit later. So the report is based on a cross-sectional survey of adults 18 years and older who are affected by cancer, and this was conducted online between June and August of 2016. While 1,218 individuals initiated the survey, the analysis is based on 1,046 respondents who reported that they were living in the United States and had received a cancer diagnosis. The respondents mirror populations that take online surveys. So they were predominantly non-Hispanic, white, and female. The majority were between the ages of 45 to 65, and 38% were working full-time. And for those of you who are looking at these numbers and thinking what we are thinking, that there is a lack of racial and ethnic diversity, and it is a limitation of this analysis, we do want to note that this really underrepresents what the access issues are for a lot of individuals experiencing cancer. So keep that in mind as I go through the presentation. 71% of the participants were in treatment at the time of the survey, and of those not in treatment, they were still receiving services because, as we know, cancer is a chronic condition, so people still need to use the healthcare system even if they're not actively receiving cancer care or active treatment. And the types of treatment that people receive reflects what one would expect for someone with cancer. I want to point out that the route of administration is up here, and it's for people who are receiving chemotherapy. And we surveyed for that information because we know that access issues may differ accordingly. So digging into the findings around access to health insurance. At the time of the survey, most respondents had employer-sponsored or Medicare coverage. Only 15 individuals in the sample reported not having health insurance coverage, which was primarily due to a lack of affordability for Medicaid or employer-sponsored care. This chart represents the distribution of health insurance type for each age group, and it would reflect what you would expect for the general cancer population. And we're really just scratching the surface today of the data that we have available from this survey. And we can dig into every data set by different insurance type or cancer diagnosis, all the different variables. So just know that this is just a teaser of what we have available from this study. So health insurance continues to be price sensitive. In fact, more than 85% of respondents reported that cost was very or moderately important in their decision making. When we probed a little bit to understand the elements of cost, the top concerns that came about were high out-of-pocket costs for services that people were receiving. This was closely followed by the high deductibles, then high premiums, and then followed by the high copay costs for medications. And this really mirrors what is often cited as the key drivers in healthcare costs. And I mentioned a little bit ago that there were two main findings, one around cost and the other around understanding. And so I'm going to pivot to understanding.